Abby, so good to see you. Today, we're going to talk through three big medical expenses that retirees often underestimate. If you are retiring soon, you need to budget more for healthcare than you're probably thinking. So, recently, there was an article from the Wall Street Journal which spotlights three major medical costs that retirees tend to underestimate. So, number one on that list, medications.
Yes, that's right. So this is one of the top ones that is often kind of out of sight, out of mind. I mean, most people when they retire, they're fairly healthy and they don't maybe think about the amount of medications that they might be on in 10, 15, 20 years. And a lot of times people have the misconception that their Medicare, their Part D coverage will cover everything. And all they have to do is pay the monthly premium. And that's unfortunately not the case sometimes. So without getting too into the weeds, there was a cap instituted last year, or this year's the first year, of $2,000 out of pocket cost on drug coverage, which was a big deal because a lot of people were paying much more than that. And costs were getting out of control. However, there's some caveats there and there are some repercussions as well. So a lot of the more expensive drugs are not included on the what's called formularies anymore for certain insurance plans. And that means if you want to stay on that drug or if you want to go on that drug, then you're coming out of pocket. It's not covered at all. So the $2,000 cap doesn't apply. Being able to plan for that, knowing that going in, and having additional sources of income and additional resources that can be tapped for these type things is going to give you a lot more flexibility in the care that you receive. So if you want to choose a medication that maybe isn't covered by your plan, you still have the flexibility to do that because it might be in your best interest. The ones that are included on the formulary might not do what they need to do for you.
Right.
So we need to be able to build this flexibility into the plan. And also, you have to review your coverage every year. There's open enrollment every year towards the end of the year, October to December. And it is imperative that you make sure that your coverage is still suitable for you and your changing health needs.
Right. Really good reminder. All right. Next we have what's being called medical isolation, which is essentially higher costs in areas with limited health care.
Yes. So here in Georgia, a lot of our clients want to either retire or semi-retire and move up to the North Georgia mountains. Beautiful up there. It is absolutely amazing, especially going into fall. And what comes with that maybe when we're younger, we don't think about is being able to get to the doctor, having access to doctors, and the additional costs that go along with that. So it might not be as isolated up there as, say, Alaska or something like that, but there are definitely additional costs that come with living away from the hustle and bustle. And if you get, into your 70s, 80s, 90s and have a diagnosis that maybe is more complicated or needs more specialty care, then probably the doctors and the hospitals in North Georgia are not going to be the specialists that you need to see or even want to see. You're going to need to travel to a metro city, probably Atlanta, to get the care that you need. And that stacks those costs on top of each other. And then if there's an emergency, those roads are very steep up there. And sometimes it's if it's really severe, maybe a life flight, those type things. So it's just the unexpected additional costs that happen when you're out a little ways. So what we talk about with our clients when we're building a retirement plan is, what's your ideal retirement? Where do you want to live? And then if those challenges are present in the dream location that they have, let's just build that cushion in so that you don't have to, on top of a health crisis, be worrying about how it's going to affect the rest of your retirement and your budget.
Mm-hmm. And last we have concierge care. In some areas with large affluent retiree populations, doctors are increasingly turning away patients who are on Medicare and accepting new patients only if they pay an annual fee for concierge medicine. And that fee is averaging $3,500 a year.
That's right. So this is definitely gaining popularity, and I can see why. I've heard of a lot of our clients that have had doctors for a long time that are either offering this service or even requiring it. Like you mentioned, they get to choose whether they accept Medicare or not. And a lot of doctors' offices around here do. Most of them do, I would say. But as the regulations get more and more strict, as there are more and more red tape, which happens with government programs, of course, there's going to be more and more of this. And you want to be able to, I'm not saying that everybody needs to do this, certainly not. However, you want to be able to choose if you want to do it or not. So you need, again, it goes back to that flexibility and giving yourself the freedom of choice, no matter where you are in retirement. So if you want or need a concierge type doctor, or if your favorite doctor that knows everything about you and you trust them so much, if they go to a concierge model, you want to be able to opt into that and build that into your budget, which is crucial to be able to make sure that your assets are keeping up with inflation. At least don't have too much lazy money. Make sure that your income sources are increasing so that you can build these lifestyle choices into your retirement plan and have as many options as you want to for you or you and your spouse.
Yeah, I like what you're saying, Abby, that it's not about, changing your goals or downgrading your dream. It's just about planning for it, which I want to underscore the bottom line, which is that healthcare and retirement isn't just about insurance. It's about planning and to show people what that looks like in your office. This is a little bit overwhelming here, but what are we looking at?
Yes, it is. So this is what we call a lifetime health cost table. So this is just a tiny snippet of our overall retirement plans for our clients. And so what we do is not only do we look at obviously taxes and investments and all of those sort of things, but we also look at, what are we going to project for your lifetime health care costs? Because it's not just paying for Medicare, it's paying for all the out-of-pocket things or all the other things that maybe aren't even covered by your Medicare. And then also, if you don't plan properly, you can see down here, this is a projection for average long-term care costs. This is a couple. So in this scenario, it's both of them having a long-term care event at different times, of course. But for the wife here, the second year of her long-term care is projected to be over $220,000. And if you assume that that's coming from a tax deferred account, you have to take way more than that because you're going to be paying 25% just in federal taxes alone. And so that's the type of thing we want to know now so that we can build a plan where those type things, those surprises, those massive tax hits don't happen. And then maybe they won't happen ever. That's great. But you have it in the back of your mind that if it does happen, you have a plan and it's not going to blow up the rest of your retirement plan.
Right. Well, clearly, Abby, there's a lot of planning that goes into a retirement and specifically these medical costs that, like we said at the beginning, a lot of people underestimate or simply don't put into their plan. So if somebody would like to sit down with you, you plug in their numbers into that spreadsheet, what's the best way to reach you?
You can always give us a call at 678-442-0255. You can also visit our website, theretirementfamily.com. We have a lot of great resources on there. You can follow us on Instagram, on Facebook, on YouTube, and there's a host of different videos and articles and calculators. And then also you can send us a message. So send our team a message, let us know what's on your mind, and we can set up a 15-minute introductory call with one of our fiduciary advisors where we simply just get to know each other and see if it's a good idea to maybe take the next step and go to a discovery meeting where we really take a look at your specific situation and see if there's anything that we can assist you with.
Okay. Abby, thank you.
Thanks, Erin.